So in conventional medicine, we're taught to make a diagnosis and to treat either with drugs, radiation, or surgery, as you say. Whereas in functional medicine, it's more of a roots cause approach. Why is this happening? And the problem is usually multifactorial. It's not usually one thing. And you have to find what the potential causes are and treat them individually. It's a very successful approach to improving health.
You are listening to The Dr. Haley Show, the podcast dedicated to helping you optimize your health. Each episode, there will be an interview or a message to help you discover better health. We will be featuring health radicals on the show to bring new ideas to the table, as well as doubling down on key fundamentals to support you living your best life. Your host is no other than the founder of Haley Nutrition, Dr. Michael Haley.
This is the Dr. Haley Show podcast. I'm Dr. Michael Haley, your show host. I have a bigger smile on my face now. This is going to be interesting. Today we're going to be talking about fertility, an important topic, a political issue. It's related to the survival of our species. It's an indicator of health of a population and important in the survival of the fittest theory, natural selection, that is. We're going to be talking about reproduction because the world has changed and the numbers are changing along with it, not in a good way. Dr. Marina Straszak Suri has over 30 years' experience as an OBGYN doctor, where she takes a holistic, functional approach to patient care. She's also assistant professor at the Faculty of Medicine at the University of Ottawa. She is author of the book, Optimize Your Fertility Naturally, a holistic guide to achieving a healthy pregnancy. It's a book to help both women and men learn proven lifestyle changes to help them increase their chance of natural conception and a healthy pregnancy. Dr. Marina, thank you for joining me on the Dr. Haley Show. And I'm going to start with a little disclaimer. This is a rerun. We connected. I've done over 130 podcasts. I have you on, and we connected and had a wonderful discussion just a few minutes ago, and I realized it wasn't being recorded. And you're gracious and taking time to do it all again.
Yes, let's do it again. It'll be even better this time.
Yeah, you're amazing. I want to thank you. And some of it might be, we might summarize and even hit some of the highlights. Because, we talked about how important this is, not just the ability to reproduce, but I think one of the keys of our discussion that we didn't record was that it's literally survival of our species, survival of the human population. We are coming to the realization that humans probably aren't going to be here forever. The environment that we're in seems to be getting to a point of not sustaining people. People aren't reproducing. What the heck is happening?
Yeah, it's crazy. Almost every first world country is not reproducing at a level to sustain its population. So in 20 to 30 years, there's going to be a big gap in the workforce, which is necessary to keep the population running, to do the work that needs to be done, to look after the elderly, and to pay taxes, this is a very scary proposition because we really don't know how this will be handled. The earth has never faced this kind of threat before.
I'm in the United States, and we pay Social Security taxes, and people that are retired have a benefit. They paid their whole life, and now they are getting money paid back to them so that they can live out their remaining days. But the concern is the funds are going to run out, and probably because we have so many people that are retired compared to the people that are still working to pay those taxes and provide for them. Is that kind of what you're referring to?
Absolutely. Absolutely.
Yeah.
That's what I'm referring to. And I don't know how this can be handled other than immigration, because Africa is the only continent that is still positive in terms of fertility rates. Their fertility rates are declining as well. However, they're still on the positive end. So their populations are still growing.
Yeah, I almost
So,
see a connection between the population and the national deficit. There was a point when we operated in the black financially, and I'm talking about the United States here. You're in Canada, and we started operating in the red, and there's this thing called a deficit, and that's how we don't have enough. So we essentially print money to make up for the deficit, and the deficit continues to, be there, and the debt is a accumulation of each deficit. Sometimes we can reduce the deficit, but we're still increasing the debt. We're never getting out of the hole. And
mhm,
printing money is almost like saying, oh, well, that's okay. We'll just import people. You can't do that forever. It's not sustainable because you're just
that's
taking
right.
away from somewhere else.
We're borrowing from the future, but how can we borrow from such an uncertain future? It's a little scary.
Yeah, I mean, if they're also decreasing in their baby production and we're importing them to meet our needs of population
Hmm.
sustenance, well, eventually they're going to run out of people for us to import. It's not a fix.
No, it's not a fix at all. So we really have to look at ways to increase fertility rates, both from a medical point of view and a social point of view.
Yes, yes. So this is probably, from my opinion, the best measure of the health of people. When people are sick, it's sometimes more obvious. They're throwing up, they're sick. But when, the slow, long changes to stress levels and everything creates problems that we don't see. And it's actually measurable in our reproductive rates. Do you agree?
Yeah, absolutely. Some people say fertility should be considered a fifth vital sign, like your blood pressure, your pulse, your temperature. Well, how fertile are you? So it's not as if there's an easy measure of fertility. That's
Yeah.
more of a concept because it's a multifactorial thing. But when you're not getting pregnant, you have to think that there is a reason. And for some reason, people don't think of fertility as something to do with their general health. They think they can eat badly, never sleep, be stressed, and still get pregnant. Well, when your body is stressed and you're putting out lots of cortisol and norepinephrine, that's supposed to be an acute situation. The saber-toothed tiger is attacking you. You have to either run away or fight with it. So, what cortisol does is it sends blood to your muscles and it takes it away from places like your brain and your reproductive system because those are not necessary in this time of stress. But then you have chronic stress and it's going to affect those things in the long run. It's a very unhealthy situation.
You enjoying the show thus far? One of the many health secrets that we have covered on the show is all around aloe vera, specifically drinking raw aloe vera. Our aloe vera has helped our customers effectively heal their gut, increase their intestine health, lower inflammation in the body, eliminate and/or decrease acid reflux, have glowing skin and hair, and so much more. Now, as a frequent member of our audience, you will be exposed to exclusive specials and coupon codes for the awesome products manufactured by Haley Nutrition. That's right, for simply being awesome and tuning in. You can get a mini discount to help you optimize and better your health. To see how we can help and support you on your health journey, tune into the episodes and listen for coupon codes that you can use at www.haleynutrition.com before you make your orders of raw aloe vera. Once again, it's www.haleynutrition.com. Now, back to the show.
How do you manage these stresses?
So, my belief is that first you try to identify them and seek ways in which to manage them because they are manageable. It's often if it's a job stress, it may be a relationship stress within that job. So if you can approach what the actual problem is, you can be less stressed. There's other stressors that, of course, the economy, I can't do anything about that. So I just have to live with it. Then you
It's
have to
all
find
related.
a way that you can manage it on your own terms. And there are so many things available. I mean, people do meditation, people do exercise, people get together with friends or do creative things, artwork. But there's also programs. For instance, for fertility, there's specific programs. There's a mind body program that is available online, which is a series of webinars that help you approach your stress and how to deal with it. And it's been proven to improve fertility rates significantly. So there are things available that people don't know about.
Yeah, that's great. Let's talk about the difference briefly between mainstream medicine and functional medicine, because it sounds like that's more of a functional approach, getting to the root of a problem, rather than a medical approach treating a symptom. And I want to put it out there. My people know me. When it comes to these things, there is no judgment on whether you're doing a medical approach or a functional medicine approach. There are places where medicine is very beneficial and it works. I'm going to read that definition again from cancer.gov when it comes to mainstream medicine. And it says that mainstream medicine is a system in which medical doctors and other healthcare professionals, such as nurses, pharmacists, and therapists, treat symptoms and diseases using drugs, radiation, or surgery, also called allopathic medicine, biomedicine, conventional medicine, orthodox medicine, and Western medicine. In the area of reproductive health, or someone just not being able to get pregnant, a medical approach would be what?
Well, firstly, you want to see whether the woman is ovulating, whether her tubes are open so that the sperm can reach the egg. You want to make sure that the partner has a reasonable sperm count. And those are basically the first things that you do. And this is looking at fertility as more of a plumbing problem, It's the simple things. Usually the health of the patient is barely looked at. If these things don't work, they're often sent for IVF as the next step. My contention is that there's a lot there in between, that our general health is so affected by our lifestyle, our diet, our exercise, our sleep, our stress reduction, the influence of chemicals in the environment, and that we need to look at these issues if we want to improve fertility rates. I'm a conventionally trained doctor. I was not trained in this. I have an interest in this. I got interested in functional medicine over 20 years ago, and it's improved my own health. So I've brought elements of it into my practice. I'm not a functional medicine doctor. I'm a conventionally trained doctor with an interest in functional medicine. I don't have the time to practice functional medicine. It's very time consuming. History taking could last 2 to 3 hours. I have 15 minutes, I can't do that. But I can bring elements of it, and I can make suggestions, and I can actually sometimes refer people to functionally trained doctors, especially when they have chronic diseases that are complicated and it's difficult to understand. So in conventional medicine, we're taught to make a diagnosis and to treat either with drugs, radiation, or surgery, as you say. Whereas in functional medicine, it's more of a roots cause approach. Why is this happening? And the problem is usually multifactorial. It's not usually one thing. It's complicated. And you have to try to find what the potential causes are and treat them individually. But it's a very successful approach to improving health.
Yeah,
Sorry.
my perspective on medicine is it's there to buy time while you fix the problem. And when properly used, medicine can be beneficial. But if we were to completely rely on that, it's not sustainable. If we just merely treat the high blood pressure and never figure out, well, why is your blood pressure high? Do you need to change your diet? Do you need to lose weight? Or, obviously you're trying to probably force blood to some area that's not getting it. Your body's probably raising blood pressure for a reason. And if we lower it too much, you're going to have signs of dementia. So what
Possibly.
we really have to actually get to the cause. So the medicine could be there to save your life. We don't want your arteries to explode as we lower your blood. That's why we're lowering it. But we got to figure out what the cause is. So if we use it like that, now we're looking at an integrative approach. Medicine is there to buy time while we figure out what's going on, so that hopefully you don't need the medicine anymore down the road. And when it comes to reproduction, in the area of fertility, if we're just continuing to use the medical approach to bring an egg and sperm together and make a baby, we're probably going to continue on the path of more stress, less health, and life is no longer sustainable at some point in time if you let those things get out of control. So we have to address the natural. And I commend you for bringing that in as a medically trained practitioner and saying, okay, this is how we can incorporate some of the natural things. And at some point, I need to refer you out to someone that could take it next level. It makes sense. What are some of the results you've seen in people that have maybe taken a combined or a more of a functional medicine approach?
Excellent results. I gave my husband's great niece a copy of my book before publication. Actually, she was one of the first readers to give me feedback. And she was 38 years old and she has never been pregnant. And she was sort of saying, well, she's been told she should freeze her eggs before she tries to get pregnant so she has eggs for future pregnancies. And I said, listen, don't think that way. First of all, improve your health. She and her husband literally did everything I suggested. It was amazing. And she had this great fear that she wouldn't get pregnant. She got pregnant her first cycle as soon as she tried. She was just like excited over this. And so she's a big proponent of, reading my book. But it's amazing, what can happen when you really pay attention to all of these things.
For those listening, you're probably listening to this in December of 2025. Dr. Marina, when is the book coming out?
Hopefully January of 2026, if all goes well. But it's my first time doing it, so I'll see.
And where's the best place to find that book?
So right now you can go to my website and there's a waiting list. My website is drmarinaobgyn.com. It's drmarinaobgyn.com. When it's out, it will be on Amazon and Ingram Spark. I just have to learn how to do that, but that's the plan.
As a thank you for tuning into the Dr. Haley Show podcast, I have a special coupon code that can be used throughout the month of December 2025. Get $10 off your purchase of $100 or more at HaleyNutrition.com. The coupon code is Charlie. That's CHARLIE. And as usual, you can even use this coupon with on sale and already discounted bundled items. Enjoy the rest of the show. Tell us a little bit about your practice. Do you do telemedicine or just a clinical setting?
So I don't do telemedicine. I have a physical office that I share with my husband, who's an internist. I no longer am in the hospital, so I don't do deliveries or surgery anymore. That was way back, in the earlier years. Now the younger people can stay up all night. I don't need that anymore. So I have an office practice, but I do bring in elements of different things. For instance, I have a vaginal laser for improving genitourinary symptom of menopause, for instance. I also do platelet-rich plasma. So I learn new techniques and try to bring them into my practice. But at this point, I'll probably be retiring from my practice within the next 3 years or so. I don't want to practice past the age of 70, I've told myself, so that's my deadline. But I'm 66 now, so I have a bit of time left.
Well, you never know. If you keep on practicing these, natural things to health and continue to reverse your age, you might never get to 70.
I
right?
might never get to 70 biologically speaking. We'll see. We'll see. But it also depends on my husband and his plans. Although he's a workaholic, he just may never retire. But I love writing and I love speaking. So I'm sort of really developing another career. I don't see that I would just sit around and do nothing. I have plans.
Well,
Maybe I'll
you're
have a podcast. Yeah, I'll come to you for podcast lessons.
there. You go. Okay, let's do it. Yeah, I'd be happy to help you in that.
Yeah, I
Uh,
think that would be lots of fun.
you know what's fun about a podcast, and I get to have people like you on this, and we recorded a podcast before the one we're having right now, which may or may not ever get published. I learned a bunch of whole new words in it. And every time I meet with an expert in their field, I'm learning new things. I absolutely love it. And it was funny because you asked me if I ever heard of something, and you named it, and I said, being a little humorous, I said, well, I am a doctor. But no, I never heard of it. Humility is probably my greatest trait, right? Uh, but
We're all constantly learning, and that's the fun of life, I think. It's just amazing.
that's what I love about the podcast.
Yeah.
It's, I get to talk to an expert like yourself in this very niche area, functional medicine, what's it called when you do natural and medical integrative type approach
Yeah.
for
Mhm.
fertility. It's fantastic. Well, we had a wonderful discussion that I don't know if it ever get published. And I brought you back and we said, let's connect for maybe a summary. And I know this doesn't get into it like we did at all in the previous hour. So people are probably going to want to know where they can find out more. There's your book on the website we already talked about.
Mhm.
You mentioned a couple other things earlier. You mentioned an
Yes.
app.
Oh, yes. The app that I recommend for stress management, it's on the heartmath.com website. It is an app that you can download on your phone, and it has a little probe that goes on your earlobe that measures your heart rate variability. And the program teaches you with breathing and meditation type techniques to improve your heart rate variability, which actually improves your health, longevity, and fertility. So I refer people to that all the time. I have no vested interest in that. I should buy shares in the company because I believe in it.
Well, when you mentioned it, I asked you, do you use it? And yes, you have
Mhm.
the app. So
Yeah, yeah, yeah.
there's some evidence to it right there. And when someone has something that they're using and they're getting a benefit from, I want to know about it.
Yeah,
So I'll put a
I
link to
think
that in the show notes as well so people can find it. I think that's
great.
fantastic. When we were talking about that level of stress and the stress management, we talked about how some people manage stress better than others, but that doesn't mean people can't learn how to manage their stress.
Hmm.
And I thought it was humorous because I had said, well, I know people that stress seems to just go right by them. They never actually experience it. And you kind of laughed. You said, I know my husband. He never gets stressed. I know some people like that. I want to be more like that.
Well, actually, there's a genetic component. Have you ever heard of the genes, the Warrior versus Worrier gene? Have you ever heard of that?
No, I
It
like it
it
though.
it actually there's a gene called the COMT. It's the catechol O methyltransferase gene, and it's the gene that controls the enzyme that breaks down dopamine. So if you break down dopamine too slowly, you tend to have more dopamine, but it's the same gene for norepinephrine. So you tend to have higher levels of norepinephrine than other people. And that makes you a worrier. So I know this very well because I have this, my mother has this, my daughter has this. We are worriers.
But your
The
husband does not.
opposite is warriors.
He's
Those are the people who are ready to go and fight the world,
he's
and
the
they don't have
warrior,
that gene
not
combination.
the worrier.
Warrior versus warrior. Yeah, so it's interesting. So there are genetic reasons for this, but also your genes can be influenced by your environment. So you can improve the enzyme function by taking cofactors like vitamins and minerals, which are known for each enzymatic pathway. So when you do your genetics, you can learn how to, mitigate the things that you're born with. So actually, environment is more important than your genes.
Do you have a favorite genetic test that you recommend? Or do
So,
you?
I did 23andMe way back when it first came out over 10 years ago. I did our whole family. And that was the cheapest way you could get a lot of information. Unfortunately, it's gone bankrupt. But the secret was that they actually tested much more than they told you about. And if you knew how to get in the back door to browse your data, there's a lot of genetic testing that they didn't give you the information, but I could download it all. So I've downloaded it all. And as more information comes out about genes, you can look it up. But now that isn't available.
They didn't have the database available for you to still download it. If you didn't download it, you can't get it now.
It may be still available, but the company's gone bankrupt. I don't think you can do the testing anymore.
I see.
Like, I think they sold to another company. I'm not sure whether you can test it all. But there are many other companies out there who do testing.
And I want to say that a genetic test where you can get the entire database of your genes is probably a couple $100 maybe.
Yeah, so it's not the entire genome. I've also done that because they were looking particularly at single nucleotide polymorphisms, but they measured thousands of them in the 23andMe database. Now, other genetic tests will only measure, like, there's a test called Nutrigenomics with an X out of Canada that measures 70 markers, which they feel are the most important in terms of how your nutrition interacts with your genes. There's a Grow Baby test that looks at 40 markers. It's particularly looking at improving outcomes of pregnancy, which I talk about in my book. So they're getting more specialized, but this is a fascinating area because
yes. Do you order the test then for your patients and then help explain the results? Is that how it works?
Yes, I do that for my patients, particularly for nutrigenomics for fertility, but it can be used for general health and longevity as well.
And stress management.
And stress management, yes, that is part of it. And detoxification of chemicals. And this should be being used in medicine more because we all react to medications differently according to how we metabolize them. And in the future, personalized dosing will start happening, but it's just not happening yet.
Okay. Well, Dr. Marina, we could probably talk forever. It seems like we have. For the people listening, I'm sorry. I may have lost our whole first hour of discussion. But for that reason, the best way to get in touch with you is
Dr. Marina, OBGYN.com. I do a weekly blog on fertility issues. There's a way to reach me. There's information about my upcoming book. And there's a free report at drmarina.com/free report, all one word.
Perfect. Thank you so much.
Thank you for having me. It's been a pleasure.
I hope you enjoyed that episode today on The Dr. Haley Show. Make sure to hit subscribe on whichever platform you are listening to this. If this episode made you think of someone, go ahead, take a screenshot, and share this exact episode with them. You can catch the show notes for this episode on www.drhaley.com. If you want to geek out with Dr. Michael Haley on other radical health topics, be sure to check out his YouTube channel, where he posts exclusive video content. All the details are at www.drhaley.com, and we can't wait to hang out with you on the next episode.